Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the episode for you today? I promised you I was going to bring you amazing plastic surgeons from across the country, and today I have a very special guest, Dr. Angela Sturm, and she is a board-certified plastic surgeon here in the city of Houston who works on face, does amazing face work, and I am so excited to have her on. Thank you, Dr. Sturm, for being on the show today.
Well, thank you so much for having me. I'm really excited to be here.
Thank you. So, you guys, before we started recording, we were talking about what are we going to talk about today? And I told Dr. Sturm, one of the things that really interests me is the younger facelift. And it's also a topic that's very interesting to her because she has experience in it. So today's topic is going to be younger facelifts and kind of what are the benefits and what are the cons of having a facelift when you're younger. So thank you, Dr. Sturm, for being our guest today. And let's dive into it.
Of course, and thank you. Like I said, like when we were talking beforehand, this is one of those things that I really have gotten into. I really like, I've seen a huge shift from whenever I started practice, and my, average age was late 50s, early 60s, and they had tried all the different things, and then now was the time to do it. And honestly, that's what that's how people talked about it, and that's how we learned it as well, and that's how people knew is okay, well, you try this and you try this and you try this, and then whenever none of that's working, then you have the facelift. And granted, there's some great non-surgical treatments. They all have their place, and they all, I have a bunch of them, so I definitely love them. But some of that we found out is maybe not as accurate in this will get your skin ready, it'll make your skin healthier, because you're dependent on some collagen stimulation, which also translates to scar tissue, to create some of that tightening. And so that was the things that we were finding when we were doing facelifts on people is, this treatment maybe is harder because you have more scar tissue, and this treatment maybe not as bad, but it has this other thing, or this treatment is not so, I can't really tell the difference, And so we've learned a lot in the past 10 plus years of what to do and not do. And people are more educated, which I think is wonderful. And thanks to people like you, that are helping to get people real information of, okay, this is my issue and this is what I'm looking for. Should I do this or should I do that? And I have more and more people they're my age, in their 40s that are like, I'm seeing it, it's coming for me. I see it. And like, what can we do? I kind of just want to do this while I'm young and I'm healthy and I recover faster, and you can get this amazing result that's going to last for a really long time and not have to worry about, oh, is this going to affect this later, or, that sort of thing. Definitely seeing the trends shift to more
I
younger,
love that. I love that. So for my girls who are listening, this episode is for you. If you are looking in the mirror and you are seeing the signs of aging about to hit you like a train, and you're like, wait, this didn't look like this a couple years ago. And you're starting to think, what can I do to make my neck skin tighter? What can I do to make my cheeks lifted like they were a few years ago? So a lot of times women will start looking for the non-invasive procedures. And that's what Dr. Sturm was just talking about. There's all these non-invasive procedures on the market that are marketed for skin tightening and lifting. But what we're finding is that some of them are good. Some of them are causing issues during surgery, not issues, but more complex surgeries because of the results that they give. And the results aren't even that amazing. And they still cost a fraction. They're still expensive. So you're still spending. So with we've had this conversation on previous episodes where I like to ask my surgeons, like, how do you decide when it's time for the surgical procedure? And I was just telling Dr. Sturm before we started recording that I've been looking in the mirror and I see my mom and I see my mom's face coming and I'm like, okay, so now I just turned 36 and I see the signs of aging in my face and I'm like, am I ready? Am I not ready? And I'm considering doing it younger, maybe not now, but definitely within the next 5 years to get that longevity, right? Like get my results and get to enjoy them for at least
Right.
a good part of my life.
Right, exactly. Exactly. And it's, to me, it's that point of, if you lift it, that it's enough result that you're like, yes, this was worth the recovery time. This is worth the money, because if you do it before that point where you're like, there's not really that much, it's not going to be enough difference, then you're not going to be as excited about, yes, I'm so glad I did this, because that's what I want with every surgery. I don't want both me and them on the other side going, this was so great, So that point where you're like, yeah, this could be better and this could be better. And that, you do this in the mirror and you're like, yeah, that's definitely better. So you and I can see the difference whenever we look at the before and afters. We're like, yeah, that's amazing. But the ideal is before anyone else can tell, that they're like, oh, you look great. I had a post-op patient come in yesterday, I think, and she was like, yeah, I saw these people and they were like, oh, you look so good, and they couldn't put their finger on it. I was like, perfect. That's exactly what I want. Is like, you're so young, you're beautiful, everyone thinks, they're going to say, why are you doing this? Because, it's not their face, and they can't tell the little things that we see. But like you said, you do it and then you can enjoy it for the rest of your life. And you always look 10 years younger and they wonder why you don't age. And that's perfect.
That'll be your little secret. Well, I had
Exactly.
my
They don't need to
facelift
know.
early.
Exactly. Only the friends that,
So
are not going to judge.
exactly. One of the things that we were also talking about off air was a lot of my girls will go and they'll get a quote. They'll say, hey, doctor so and so, I'm considering this. And then they get a quote. And sometimes they get scared by the number, by the amount of procedures that the doctor is recommending that need to be done in order to get the result that they're looking for. So, one of the things that I think we could talk about is why do multiple procedures at once when you are considering a facial rejuvenation surgery? And why, like, if you're going in for your mid face or your neck, why would a surgeon recommend that you also have a brow lift or a upper or lower blepharoplasty? So why don't we talk a little bit about that?
Part of it is like philosophy, if you're going in for rejuvenation, and I try to read the room, read the patient, like, where are you at, what are you thinking, because I personally, as a patient, I'm more like, this is what bothers me and this is what I want to do. Like, if you try to tell me other things, I get a little overwhelmed, and and you get the quote, it's got a million things on it and you're like, I don't know, I don't want to do anything, which is totally normal. Be like, I'm not sure, and so I think for me, I have a very detailed conversation with the person, kind of like, what are you looking for and what are we doing and what are your goals and what is the long-term plan, and I talk to people about, some people like to break it up. If they're like, yeah, I know I could do my eyes, but that doesn't really bother me right now, and this is what bothers me, and have an open conversation about, you can totally do that and that's not a problem. Just know, if you have two surgeries, you have to pay for OR and anesthesia twice and recovery twice, and as long as that fits in your budget and your schedule, totally doable. Some people feel, especially if you have a pretty dramatic lift, they feel strongly about doing a brow lift at the same time, just so it all is lifted up at the same time. It depends for me. I don't feel strongly of, if you do this, you have to do that, because it doesn't, surgically I'm able to do it, and so you can lift this, you don't have to do that, and so it's not going to cause bunching or a problem, which is like the concern. But it's more like, what are you looking for? Is this going to give you the overall rejuvenation? Like, you're wanting this, and is is that going to give that to you, or are we going to get done and be like, yeah, but I still look tired, like what is it that's bothering you? And so making sure we're on the same page. And I have like a computer program where I draw it out. We look at different options of like, okay, this is doing everything. This is doing, which I try to read the room too with that, because that can get overwhelming too. If you get too many pictures and you're like, I don't know. I thought I knew what I wanted, but I don't know now.
They bring in, I've seen where they bring in like a picture of themselves from 20 years ago, and maybe they're in their 50s or in their later 40s, and they're like, I want to look like I did. And they bring a picture of themselves in their 20s. And a lot has happened in that 20 years, because gravity has no mercy on anybody. And it's pulling everything down slowly. And one of those things that I see all the time is kind of everything looks like it's melting.
Yeah. That's something I hear from my patients. They're like, my face is melting. Just like, pick it back up. And sometimes it's really helpful, like especially for things like brow lifts, where maybe like me, my brows have always been a little bit heavy. And so that's not necessarily something that's changed over time, but other people it is, it's something that does make them look more concerned or worried, or, not as approachable, because that's a concern for people too. They're like, I want to work for another 20 plus years, I want to be as marketable as possible. And so seeing those pictures are helpful for me for that perspective of like, okay, well, where's your brow position? How did your eyes look then? And how do they look now? How was your jawline then? And what can we do? And then using that to kind of image, like, this is what we can do now, and this is where we can go. And I don't ever like to shoot for, we're going to look like we're 20, but I'm like, you're going to look like you're really good, at your age. And if we can rewind it 10 years or so, that's fantastic, because I think you get a little bit of that going off the wrong direction whenever we're like 50 trying to be 20, like we're like, okay, that may be a little much, but we can look really good for you and really good, for a 40-year-old. Yeah.
Exactly. Like, we can't get you to look like you're 20, but you'll look like a really good 30-year-old, or like you'll look really good for your age.
Right. Exactly. Really good and like refreshed.
What are some of the things that you like to do for your patients to help them get ready, as far as, let's say they want to have a facial procedure in the next year, but they're not ready to do it now? What are some things that they could start doing now to help them prepare their skin and get ready for that major surgery?
I feel like if you have good skin, like we visually think that person looks younger, like the good skin it's one of those like hacks of these people that you're like, wow, you look great, and so if we can get them on a good skincare regimen, just kind of talk to them what they're doing, if they already have one, or if there's anything we need to tweak about it, or, and then we talk about some of the non-surgical things that don't interfere with surgery, like microneedling is amazing, love our Botox, things like that you can make your skin quality really nice. We can help work on if they have some brown spots or pigmentation to clear some of that up before we do surgery. So whenever we do it, it's like, this beautiful clean palette, and all of that is just working in the same direction that we're going to go. I wouldn't start them on like a skin tightening, like we were talking about before, like we used to think about, oh, we do the skin tightening now, that's going to help, and like, okay, definitely don't do that. But we can do regular microneedling, which is one of my favorites, or some exosomes, and just kind of work with their actual skin quality and get that as good as possible. And then the surgery will just be like that much better and heal that much better, and just much better of a result.
I love microneedling. It's definitely one of my top favorite procedures for face, and pretty much for anything, honestly. You can even do it on your scars. You can do it on all types of places, and it has tons of benefits. So microneedling, number one. So before we started recording, we were getting into some juice that I was like, wait, don't tell me. I want to save it for the show. And one of those things is she was going through a list of like the different non-invasive procedures and how much they can interfere with the surgical procedure. So why don't we go through them? Because I know our listeners are wondering, like, okay, what can I do that won't interfere with when I do want to have surgery?
Yeah. So all those things that we talked about are great when you get into like the microneedling with RF. I have personally haven't seen as much problems with like scar tissue because a lot of times they don't get deep enough. But what I've seen is it changes the dermal plexus or the little veins and the vasculature and the skin. And so if it hasn't been long enough from the treatment, sometimes their healing takes a little bit longer. Like it'll get there, but like not ideal. And so that's like Morpheus and Secret RF and things like that. There's like the minimally invasive things that for me, that is the conversation with me. If a facelift is on the table, we're not going to do the minimally invasive because it does cause scar tissue. Face tight is great for someone that's like, I'm never going to do a facelift. That's not what I want to do, but I want something, and they have a little bit of fullness here, works great, but it does cause scar tissue. It makes it harder, but not like, I'm like, oh no. Renuvion is the worst for me. The results are very pretty, like to have the Renuvion in that before and afters, those look really nice, but to do surgery on afterwards, it's so much scar tissue and it's just absolutely like stuck together. And so what that means for the patient is it could take me longer, hopefully we get as good a result as we wanted, but I try to temper expectations a little bit in that case of like, this is what I'm shooting for. But I don't know how things will exactly heal and, how bad the scar tissue is there. So that would, for me, definitely be if you're never going to do a facelift, like go for it. But if it's still kind of on the table, like I would hold off. Injectables also, like that, Botox is totally fine. And these are variable because it depends on how much was injected, where it was injected. Does that interfere with undoing? Does it not? Because a lot of times if it's a hyaluronic acid, I'm like, oh yeah, there's the filler. Look at that, and you can squeeze it. And you're like, there it is. But it's not really like bothersome. I don't change my technique or anything like that, but it's just like, oh, look at that, there's some filler and there's some filler, especially if we're out here where I'm elevating and where you're going under the deep plane and stuff. Once you get under the deep plane, it's usually fine. But if there's been repeated injections over a period of years, because we've done this for a long time, sometimes you can see more of that scar tissue, and that the planes aren't as clear and open up as pretty as they would. Sculptra is that way too. Some people are very anti-Sculptra. Like I think it's a good product and I like it in the right context and, anywhere that I'm not operating, like go crazy. And I've seen everywhere from like the little pearls where you're like, oh, there it is. I can see it's almost like a little pearl, like where this was injected, not super bothersome to all the way to where it does kind of cause some of that to stick together, and so if you've done it once or twice, it's fine. It's probably going to be fine. Like I've talked to people and they're like, oh no, I had no idea. I was told to do this and I didn't know. And now I want a facelift and is it going to be horrible? And no, like it's there. I'm probably going to see it, but it's not a big deal, but I wouldn't say, oh, go do a series. And then 3 months later, be like, I need a facelift now, like, don't
right.
Varies, just depends on how much was done. Some of it, especially like the Morpheus and things like that the Ulthera, that's one I didn't include.
Oh, Ulthera.
Surprisingly, I feel like Ulthera is worse than the microneedling with RF because, it feels like, oh, it's all super, it's on the surface. It shouldn't be that big of a difference, but it does cause more scar tissue, and so I did a lot of Ulthera at my previous practice before I opened this one, and you could get some good results with it. It was really uncomfortable. And like you said, that's one of those, it's kind of uncomfortable. It's not cheap, and then nobody knew at the time that we were doing that. Oh yeah, that can make your facelift a lot harder, so nobody knew, but now we know.
Now we know. I'm not a huge Ulthera fan now. I think now if somebody asks me, I'm like, just save up for the face.
Yeah, I'm with you because I mean the price point's so high, you might as well start saving up, and then get a more consistent result that you're like, I know I'm going to be able to see a difference because you're still kind of rolling the dice with your stimulating collagen and it should be better, but not everybody. I'm with you. I'm like, you're like, a quarter, halfway there.
Yeah, just get
Just keep
just save
going.
a little bit more and
Yeah.
you'll get more bang for your buck. One of the things that scares women from having a facelift procedure, and that's the scars. I think we've seen over the years in celebrities and people around us some really thick pooled scars. And I feel like that's kind of antiquated. I don't really see that anymore. And it's because techniques have changed. So I think we should talk about that.
Especially people with more pigmentation in their skin have been really discouraged from getting facelifts because of like, oh, the scars, I know you're going to be able to see it. Um, but like you said, with the techniques that have gotten so much better, it's really not an issue. Like I do facelifts on everybody, it doesn't matter what your skin tone is. We're able to do a facelift. We're able to hide the incisions and they heal so much better because we're doing, the deep plane where we go underneath the muscle and freeing everything up. And so there's no tension. You're not pulling against yourself. And so on the skin, there's just no tension there. And we've gotten much better at hiding the incisions. Everything I do is hidden in the hair and around the ear and just fades to where it's hard to see it all. Like I've seen people for revisions that their incision was like straight back from the earlobe, and I'm like, oh my gosh.
Yes,
That's not where that goes.
we've seen some ugly scars. Where does this facelift incision go?
So some people will come right at the beginning, at the front of this hair tuft, and then some people will go kind of inside it. It's a preference thing. I go inside it just a little bit because I like a little bit of hair to cover it. But even the people that go right in the front, it tends to heal really, really well. We go at the bottom of this little hair tuft because if you go, I don't like whenever people take it straight up because you can go straight up. But the problem is if you're lifting more vertically, you're going to lose this hair, which looks weird. Like visually our eye sees that as something odd. So I like to go in the bottom of that hair tuft. So you keep that hair where it is, the top of the ear, and then it hides in this little curve of that cartilage. And then it goes right in the edge of this cartilage. Like whenever I first started, we'd be like, we'll go on the inside, and we do kind of, but it heals better if you go right at the edge because it tends not to pull that cartilage forward. Because that's something too that visually we can see, and we're like, it's weird to like seeing someone's ear canal, like that's not natural. Down to where the earlobe and the face come together. So right in between that, I go up onto the back of the ear itself. And then variations here, like I go straight back where the ear and the hair touch. I'll go straight back there and then down into the hair, just a teeny little bit where that bone is there, inside that hair. Some people will go straight back into the hair this way. I used to do that when I started. I changed doing it because you have to advance the hairline forward here to realign that hairline so you don't have like a step off. And moving that forward did two things for me. Is I was moving more skin back into the neck, so I felt like you had more laxity sooner. And then also sometimes it created a little bunching back here, so it looks like curtains, kind of, that not as it like they lay down and it's fine over time. But if we can avoid that, it's so much better. And then, like you
I
said, our techniques are better, so we do more vertically, so we remove more skin like this way as opposed to more like that way.
and it's beautiful. Now, like I think that goes along with this undetectable era of face work where you can't really put your finger on it. You know they look amazing and they look 10 years younger, but why? And I think it has a lot to do with these advancements in the techniques of the procedures that are being done. So, what are your recommendations for scar treatments after the surgery?
So even in my people that are like, let's say a guy, that he's gonna do nothing, it still heals really well, even if if you forget, you get busy, whatever. Like just because of the way that we do it and that we don't have the tension on it. We do lymphatic massage right after surgery, so that helps the swelling go down faster. That helps, like the blood flow in that area. That seems to help. We do like IVs for patients afterwards, like the beauty IV, so you get some of those vitamins and that sort of thing. You can do hyperbaric treatments. I only do it if someone's like having a slower time heal, but that's that's always a possibility too. And then we have scar creams that we have and we sell, and that if they want to, they can use that. But like I said, most of the time we don't really even need to, and then we have specific creams that we have them put on. We use this beforehand. We have a whole skincare regimen that we put you on like 3 weeks before, and we do the elastin nectar that I love, that like kind of gets your skin ready and it makes your skin healthy and that kind of stuff. And you do it for 2 weeks after, and then we put you on to this whole other skincare plan just to make sure your skin's healing well. So
I love it. You just touched on something that we have not talked about on the show in length at all, which is the hyperbaric chamber. So to our listeners, I'm sure you guys have seen it. Something you've read somewhere in the Facebook groups or somewhere about the hyperbaric chamber, but you don't really understand it or you don't know what it is. So why don't you tell us a little bit about what is the hyperbaric chamber? How does it help? And like, why should somebody do it?
So they come in a bunch of different ways. Like you can have a one person that looks like size of like a tanning bed, all the way up to it's almost like a room that you can go into with multiple people. So just lots of different sizes. You go into it, and what it does is it compresses the air, and so it increases the pressure and increases the oxygen that your body's taking in. So depending on the way that it's made, some of them you wear a little mask, or you wear like the nasal cannula that you can increase the oxygen. Some of them you don't need to do that depending on how they're made, but it increases the pressure. And then we talk about it as atmospheres, like a dive. And so that's how we think of it, is like, this is like if you were to scuba dive and go down, like what would the depth be? And then how many atmospheres do you go to? And depending on what you're trying to do, you can do like they make these that you can use at home if that's what somebody wants to do. And they go to like 1.2 or 1.5 atmospheres. So it's like the atmosphere that we're at plus another half of a atmosphere pressure to help get that oxygen in. And that just helps you feel better, like perform better, heal better. There's some evidence that it can help you live longer. Hard to prove, but they're saying that. And then if we want to do this therapeutically, you can go down to like 2 to 2.5 atmospheres, and that's more. They use that a lot for like wound healing. So if you have people with like decubitus wounds from like diabetes, on their heels or their feet or things like that, that they're using in a therapeutic way. To help those heal faster. And you'll see those at big facilities, like the big ones that go down to that depth. So the ones that we use in aesthetics are usually between that 1.5 to 2 atmospheres, because it's some people tolerate it really well, and other people kind of get, like when you go in an airplane and your ears pop and that sort of thing, and it bothers them. So we adjust it based on like their symptoms and how they feel, but it can help all those different things. I've talked to a guy that had one in his house because he wanted to live forever. And
I want an update on that.
I know, right? I need the data. But it's something that we've used for like post-surgical healing, just to kind of help that along and get that oxygen into the tissues better to help it heal faster.
Yeah. So there's a lot of different ways that surgeons are using it in their practice. I get messages from people across everywhere. They're from across the country. And so what I know, we were using the hyperbaric chamber usually when somebody was having a slower recovery, maybe their incisions weren't healing as fast, or they look like they were trying to open up. So we'll send them for treatments at the hyperbaric chamber. Now I'm hearing of surgeons who have these in their offices, or they have them kind of part of their protocol, that whether you're having wound delaying issues or not, you still get a couple of treatments of hyperbaric chamber to help you heal a little better, help you heal faster. And I think it's great. So if it's something that's on your radar that you're considering, that your surgeon maybe gives you a couple of sessions, or they're recommending for you to have it, I don't think that's anything to be afraid of or to think that you shouldn't do it. And so for me, you get the green light.
Yeah. Yeah. Just can help you heal faster and like feel better faster. So.
And it helps with bruising, right? It helps kind of that bruising starts to go away a little quicker. Your swelling starts to go away. How many sessions do you usually have your patients do?
If it's just a routine, you can do 1 or 2 beforehand and usually about 3 after. And then, like you said, if there's someone that we're trying to help them along, we can do it every day if we need to. It's nice because it's so safe because you're like, you can do it that often.
Beautiful. I love that. So, Dr. Sturm, if one of my girls who's listening wants to come see you, how can they find you?
So you can find us on social media at Dr. Angela Sturm, on TikTok, on Instagram, on Facebook. You can find us at our website, www.drangelasturm.com, or you can give us a call, 281-336-9300.
Love it. Thank you so much for being on the show today. And with that, you guys, I'll see y'all next week.
Thank you.
Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board-certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Your support helps more people get real, unbiased info they need. And if you're ready to take the next step in your surgery journey, I've got you covered. Book a consultation with me at bigbuttsnolies.com and let's create a plan to get you the results you've been dreaming of. Follow me on Instagram at Big Butts No Lies Podcast, on TikTok, and on YouTube for exclusive behind the scenes and more real talk about plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.